COVID-19 has changed everything about our lives, how we work, how we study, and how we socialize. And now, with almost 31 million total cases and over 500,000 COVID-related deaths, this pandemic has had a great impact on our hospitals as well. On Wednesday, April 7th, San Gabriel Valley Medical Center and the city mayor held a press conference. At this event, key strategies were discussed on maintaining health and wellness during this pandemic. The purpose of this press conference was not only to provide information, but to urge the public to seek immediate care for emergent needs. San Gabriel's City Mayor Chen-Ho Liao and Vice Mayor Tony Ding also attended this press conference. Hospital CEO Nana Deeb reassured the public that San Gabriel Valley Medical Center was ready to meet their every medical need.
As we continue to urge our community to get their vaccinations, and more specifically, the San Gabriel Valley is lagging behind a little bit. We want to promote getting all vaccinated, 16 and above is coming up real soon. We want to make sure that the public does know that our facility is open to serve them. We want to make sure that people are getting treated when the symptoms are starting, not when the symptoms have gotten too severe to manage the disease. We get worried that when patients do come too late, that the recovery portion becomes more difficult, and sometimes the recovery is not realistic. So it is very important for our community to get their, scanning done, to get their knees and hips and any of these elective surgeries that they waited a long time for, because the more they wait, the more difficult these surgeries become. We want to make sure that it is okay now to come for a GI screenings, mammography screenings, quick urgent care needs. We are open for the public, and we want to make sure that the public understands it is time to get your essential needs met. And we need you to come in when they are urgent, not emergent. So really, that's what we're hoping for, and that the public does understand it is important and it is safe.
Critically important information was provided on how the public can make the best use of San Gabriel Valley Medical Center's state-of-the-art medical services and how to fully utilize their emergency services. Most importantly, the public was assured that since it's safe to go back to the hospital, there is no reason to delay seeking immediate medical assistance for any illness or injury.
Just want to remind the community it's safe to come back to the hospital and seek help, rather than waiting at the last moment when things get out of hand.
The public was also provided the most updated information on vaccines, including what steps should be taken post-vaccination. This post-vaccine guidance is now very important since almost 20% of the population has been fully vaccinated.
The sooner we get people vaccinated, as many as you can, that vulnerable period of 6 months may keep you safe until enough herd immunity develops. You can't develop herd immunity if you don't get enough people vaccinated. So from this onwards, for the next 6 months, all precautions should continue, masking and everything, washing your hands, wearing social distancing.
Dr. Theda Nguyen is the Infection Control Chair at San Gabriel Valley Medical Center. Dr. Nguyen similarly urged the public to seek immediate medical care. And she also directed the public to continue practicing safety protocols in the face of this pandemic.
If you are sick and if you're not feeling well, then stay home and please call your family doctors and follow your family doctor's instruction. If your family doctor instructed you come to the hospital, or if you don't feel well, you wanted to come to the emergency room, please do so. In our hospital, we are practicing the very rigorous protocol to sterilize, the hospital, and to make sure that everything is clean and sterilized.
Dr. Nick Kwan from San Gabriel Valley Medical Center's Emergency Medicine Department noted that when patients experience serious symptoms, there may only be a short window of opportunity to prevent serious harm to one's health.
I want to remind all the viewers that it is important to seek timely emergency care and do not be afraid of contracting COVID in the hospital, because right now the hospital is actually very safe. If you seek care timely, symptoms such as chest pain, headache, nausea, vomiting, abdominal pain, these could be early signs to more serious illness or pathology. If you wait at home because you're scared of COVID and do not come to the ER quick enough, we may miss the chance to help you and treat you. So please do not be scared. We're always here to serve the community, and we'll be ready for you for any complaints.
We are in the new normal where we are making sure that our infection prevention is very high. We have new technology, new protocols. We are very aggressive following our CDC and CDPH and the WHO. Whoever is more aggressive is really what we're following nowadays. And we are being monitored by the county, and we are being monitored by the CDC. So we want to assure you that we have all the right parameters in place for you to be safe here for care.
If you would like more information on seeking medical assistance for your illness or injury, contact your personal physician or contact your local hospital.